The Election Commission on Tuesday banned all victory processions during and after the counting of votes on May 2nd in the wake of rising COVID-19 cases across the country. This comes a day after the Madras High Court came down heavily on the poll body for not stopping political parties from violating COVID protocols during their campaign rallies last month. The Election Commission has also capped the number of people permitted to accompany the winning candidate to receive the election certificate to 2. NDTV reports that official COVID-19 deaths data probably differs from actual figures. The website, citing a ground report, said that at least 1,150 deaths did not make it to the official COVID list. Data collected from the Municipal Corporation of Delhi for 26 crematoriums it runs shows that 3,096 cremations of COVID victims were conducted between April 18th and April 24th. The total figure of COVID deaths released by the Delhi government in the same period shows 1,938 deaths, indicating that 1,158 COVID deaths in Delhi may have gone uncounted. The controversial Sterlite copper smelting plant in Tamil Nadu, closed after protests in 2018 over alleged pollution, has been allowed by the Supreme Court to run an oxygen plant to help the country tackle its deepening coronavirus crisis. Sterlite can start producing oxygen in around 10 days and should supply it for free, the court has said, adding that an expert panel will oversee the production of oxygen. India was there for the American people in their hour of need, and the United States will be there for the country as it meets its worst ever public health crisis, United States President Joe Biden said after his phone call with Prime Minister Narendra Modi. The two leaders spoke on Monday as the Biden administration swung into action to provide assistance to India in its fight against the COVID-19 pandemic. India ordered its armed forces to help tackle the COVID-19 situation in the country. In a meeting with Prime Minister Modi, Chief of Defence Staff General Bipin Rawat said oxygen would be released to hospitals through armed forces reserves, and retired medical military personnel would join COVID-19 health facilities. Also, wherever possible, military medical infrastructure would be made available to civilians.